Yolanda Turner. My daughter has lupus and her hair in the front is coming out and the scalp is scarred. What can she take or use to help? She's on medication for lupus. The most common medication for lupus is steroid, prednisone usually, to help calm down the inflammation. Natural anti-inflammatories, once again, such as vitamin D at a dose of 5,000 international units per day, omega-3 fish oil, and probiotics. I tell all my patients that suffer from autoimmune problems, particularly lupus, they need to keep these anti-inflammatories as a part of their treatment regimen, in addition to whatever else they're being prescribed, because all of the problems with lupus are inflammation. Lupus causes inflammation of the skin, inflammation of the lungs, inflammation of the kidneys. You can get what's called lupus nephritis, which is the inflammation of the kidneys, all kinds of problems. And you treat inflammation with anti-inflammatories and natural anti-inflammatories that won't cause any harm and that are also compatible with the primary therapies are very good supplements to take and just will overall improve her health. And so we want to make sure that she's doing everything she can do. Now, if she has scarring on her scalp, unfortunately, then you have lost those hair follicles. They're not going to grow back. You can surgically reimplant hair follicles. They will literally take hair follicles from the back of your neck and move them up to the front. That's the most common technique that they use for male pattern baldness, but they do it in women as well. They can literally elevate your scalp off your skull, pull it forward and sew it back down and advance it so that area is covered and you don't have bald spots there. But the scarred area is not going to grow hair. It's never going to grow hair. Just can't be brought back to life. The hair and the pores there are covered over, and so that area will not be hairless. You can always use other things to cover the defects as well, like of course hair weaves and wigs, which are very popular nowadays anyway. So she won't be any different than anybody else that's out there with weaves and wigs every day. It's just part of fashion now. So she won't be any different from that perspective. But there are things that can be done. But again, that cannot be fixed, but it can be repaired by some of the methodologies that I talked about. But they have micro implantation of hair follicles, again, where they harvest hair follicles from the back of the neck, the occipital scalp, pull them forward and implant them with a little plug planter. And they can do thousands of those at one time. And it gives you a great normal hair response. The hair grows just fine and it looks natural and normal. In the early sciences, when they did that, the technique would bunch up the follicles and it looked like a hairbrush. You'd have bundles of hair that you could look right through. But now the technology has improved so much that it literally, you can't tell it any different from a regular hairline. So that's something that you can aspire to and she can aspire to if it comes to that. But again, so that we don't get any other damage to our body from the lupus, she needs to be on anti-inflammatories. And I recommend the vitamin D, omega-3 fish oil, and even the probiotics.